I'm Gabby Karatka, a 5th semester nursing student. Today's date is 2/24/2020, and I will be going ahead and doing a Foley catheter insertion on a male. So before I've even gone into the room, I've assessed the order for the catheter as well as the size used, the allergies, and I will also assess that the last void time of my patient. I've also gathered my equipment here, so I'm going to go ahead and enter the room. Good morning, Mr. Smith. I'm Gabby, your nursing student today. So the doctor ordered for me to place a Foley catheter today, okay? So I'm going to be doing that. Let me go ahead and provide some privacy. And I'm going to raise your bed up, okay? Can you give me your name and date of birth? Perfect. Thank you, Mr. Smith. So I'm going to go ahead and first uncover you.
And then I put some more sheets just in case they forget.
And I'm going to lift up your gown because I'm first going to clean your peri area, okay? So let me go ahead and put on some clean gloves here.
Okay, I put a sign up too to remind us.
Grab a wipe here.
So one way or the other, I told them, the pages.
All right, Mr. Smith, I'm going to clean your peri area now, okay? We'll work from front to back.
Yeah, I'll take the trach out so it'll be more authentic so they can swallow. And then yours
all the way around, making sure that it's not soiled.
And if you ever need something, I'll just run up and check on you from time to time.
And once I'm done, I'm going to go ahead and dispose of my gloves. Perform hand hygiene once more.
I can,
And now, Mr. Smith, I'm going to bend your legs up at your knees and kind of spread them out a little bit to give me some working room, okay? All right. You let me know if anything's uncomfortable. So the first thing I'm going to do is go ahead and set up my sterile field. Open my sterile kit. Opening away from me. The two flaps on the sides. And the flap towards me. So once I've opened it, I can go ahead and put my sterile gloves on, so I will be sterile now. I'm going to put my dominant hand in first, so my right hand.
You want to see the other?
And then after this, now this hand's sterile, so I'm going to slide my hands under to put my left hand in.
Pull it out.
So now I'm sterile. First thing I'm going to go ahead and do is set up an additional sterile field drape, making sure that I tuck my hands so that I stay sterile. And there we go. So now I can set up my field.
This is 0.5.
Go ahead and open up my swabs. Get those out. Dispose of that. And now I'm going to go ahead and dump my lubricant in. Dispose of that. I have my 10 cc syringe, so I'll hook that up to the tubing now. After that's hooked up, I'm going to go ahead and dip my tubing 2 to 4 inches into the lubricant, so then the patient can tolerate it a little better. Okay, so now that everything's set up, I'm going to break sterility with my left hand because I have to go ahead and hold on while I clean. So Mr. Smith, these are 3 cold swabs coming around in a circular motion. Discarding of each of those. Circular motion, downward. Okay, so now that I'm ready, it's all clean, I'm going to go ahead and insert this tube. So while I do so, make sure you take in a big deep breath for me. So I'm going to go ahead and hold my tube, inserting it about 7 inches, or until I see urine output. Okay, so my tube is inserted. So I'll go ahead and fill up my catheter with 10 cc's.
Little boxes pop up. I don't know why. Just X them out. Okay. And I'll come and help you. But anyway, yeah, if you need more fluid, just grab it. And so they'll have, the other one, let's look at the
I'm going to insert a little bit farther.
Oh, that's okay.
Still sterile with my right hand.
Oh, that's just the blunt, okay.
Yeah, that's just,
That's
yeah,
never first. Oh, I know,
it's just a blunt. I mean, there's more than one way to do things, but that's what we have.
Oh, that's fine.
So,
Okay,
when you look
once
up,
doing so,
you can say,
I can detach my syringe.
just
And so now that it's sterilely in place, I am now not sterile, and I can just place my tubing taped to the leg, and I don't have to be sterile for this.
Pull their stuff up. Yeah. Here's Captain Jones, and here is.
So Mr. Smith, I'm gonna go ahead and place this catheter tubing against your leg so then it doesn't come out of place. Okay.
Is pneumococcal. So I made little labels.
Should have taped it over.
So they're gonna have like the pneumococcal, but don't stop to draw it up.
Ooh, sticky
Oh,
tape.
that's just what they draw
Right.
up with.
Yeah, so it'll be
Making
labeled.
sure that it's nice and secure to my patient's leg and has enough slack in case he does need to move. And I want to make sure that there's no kinks in the tubing,
Put these on.
and making sure my tubing is on a immovable part of the bed and hanging below my patient's waist or bladder. So now I can go ahead and remove my gloves,
Yeah.
take care of all of
I'm
my
gonna just rotate.
equipment, throwing it away.
I'll start, it'll be looking at it. So I'll.
And again, want to get one more time, provide for patient comfort. and privacy. You want your blankets on, Mr. Smith? Okay. I'm gonna go ahead and lower your bed back down and give you your call light. So if you need anything, you can call me. For my documentation, I would make sure to document any urine characteristics that came out of the catheter, as well as the patient tolerance to the catheter and the size that I used for the catheter.